The next technique I'm going to show you is for the distal end of the distal attachments of the splenius capitis and splenius cervicus. So if you place your thumb right in front of the trapezius and lift their head up, you might need to shrug your shoulder a little bit so we can get in there. I'm just going to friction those distal attachments as he's shrugging his shoulder to help reduce the tension in the muscle so I can get in there as deep as I possibly can get with less discomfort. Then I'm going to pin, and then I'm just going to tilt his head down to stretch it out. Repeat that several times until you feel that start to relax. Have them engage the shoulder, elevate the shoulder, friction, relax, and stretch. Now, Hank, if you'll just bring your arm behind your back and get even a better stretch and tilt the head down. Good. And relax, and you can bring your arm back up. Now, when they bend their head, you should feel these spinous processes moving anterior and posterior. Those joints should move. They shouldn't feel stuck together. So if they do, then you'll want to put your fingers right in between the spinous processes, and as I flex and extend his head, I just pin and stretch in between each one of those spinous processes. This is a great way to open up those facet joint, help to correct that excessive lordosis in the neck, and reduce the pain that they feel in the back of the neck. Most people will have to do some neck strengthening to help maintain that posture, but it will be a lot more comfortable for them now that their joints are moving as they were designed to do. Now, don't be afraid to use this work on people who have already had fusions. It would take a tremendous amount of force for you to do any damage to that fusion. So you just go to wherever their end barrier is and friction in between the spinous processes. Stop before you get to the soft spot. I want to stop right there about C2, C3, and then I come out to in between the transverse processes, and I'm just going to tilt his head up to the right and try to work out any fibrous knots in between the transverse processes. Really helps to have one of these body cushions, so when you stretch them down, you're not stretching into the table. You get more range of motion, which our goal is always to improve their range of motion, pain-free range of motion. I give them a little bit of a traction and a little bit of a stretch at the end of that. And then just place my fingers and my thumb in the lamina groove, tilt his head back a little bit, have him tuck his chin down, and as he does that, I just strip right down the lamina groove on both sides. Good. Now if you feel more fibrotic knots in there, you can always have them extend the head back, engage those muscles. Good. And then tuck the chin down as you strip down the lamina groove. When you get into C6 and C7, you'll also feel, especially people with kyphotic curvatures, that these thoracic joints get stuck open. And that's because the spine is curving out like that, so the joints get stuck open. And here in a little bit, we'll show you that on the spine. But once we get right on either side of that spinous process, I want Hank to bend forward a little bit for me. Good. And then we're just going to strip down. As I'm stripping down the muscles on either side, I'm just going to have him tucking his chin down as I strip down the spine. How does that feel?
Great.
Good. And come back to neutral. This time I'm going to use my elbow to do this. And bend your head down and then just strip right down those muscles. And relax, come back, and again. Great. In the next segment, I'm going to show you an additional stretch to help elongate the spine and help reduce that kyphotic curvature.